All right, let's get started. Thank you everyone for joining today. I'm Dristan Phillips, and I work at USC for the program on global aging, health, and policy. And kind of our outward facing side of that is the gateway to global aging data. And we're going to be talking today about the gateway to global aging data and harmonized data sets that are produced here by our center. There's a couple ways to interact with this webinar, which I would encourage you to do. One is you can ask a question in the question box, and I'll try to make sure to answer that. There's also a chat window, and you're welcome to pose any questions or ask for any more explanation there. And if you'd prefer to ask something verbally, you can raise your hand. There's that raise your hand option, and I can unmute you. Everyone's currently muted except me, and I'm happy just to discuss with you out loud if that is easier for you. All right, so let's get started. So today's webinar is an advanced webinar, and we're going to be featuring in particular the harmonized share. By advanced webinar, I mean I'm assuming that you have some familiarity with the share, that it's a survey conducted in Europe, and that it's conducted to people 50 and older, it's longitudinal, and also some familiarity with the gateway to global aging data. If you don't, you're welcome to continue to follow along, and I think it would still be helpful, but I would encourage you maybe to go back and watch an introductory webinar. We have those available. You can download the slides from our website, g2aging.org. It's the gateway to global aging data. Or you can watch a video also on YouTube of our last introductory webinar to give you an idea of all the surveys that are included in this set of surveys around the world. So let's get started. So in this advanced webinar, we're going to be kind of doing this in two parts. And the first is we're going to do an analysis using just the harmonized share. And the second is we're going to do a cross-country analysis, really a cross-study analysis using the harmonized share and the harmonized Charles. And Charles is another health and retirement survey which is conducted in China. So we're going to be creating a data set which has data from both the European countries of share and from China. There are two handouts that are available to you, and they're called Part 1 and Part 2, and these relate to Part 1 and Part 2 of the agenda. They're currently called .doc files, and they're actually .do files, and they're .do files because we're going to be doing this webinar in Stata, which is a statistical analysis package. So if you would like the codes yourself, you can download that code there. We'll also have the code available on our website after today's webinar, as well as the slides from today's webinar and the video from today's webinar. We'll put that all available on our website. So if you would like to follow along, you could follow along with that Stata code, or you could just watch. So we're going to pose a research question. And that question today is, are there country differences in financial support to children, and are there differences across different ages? So we just recently, as of this morning, updated our harmonized share data set. We're constantly expanding these data sets. And one of the set of variables that we added to this data set was these measures of financial transfers between parents and children and other relatives. So we're going to be looking at the financial transfers to children. We're going to look at, are there different levels or frequencies to which parents are supporting their children in different countries. And then do we see differences for different aged households? Do we see that couples in their 50s are more likely to support their children, say, than couples in their 80s? What does that look like, and is that different in different countries? So to do that, here's the steps we're going to do. So we're going to create the harmonized share data set. We're going to identify our relevant variables. We'll create some additional variables for our analysis. We're going to apply weights. We're going to analyze giving to children across different countries, these share countries here. And we're going to analyze giving to children across different ages and different countries. So to start out, so to create the harmonized share data set, So the first thing you want to do to create the harmonized shared data set will require you to first download the shared data. And let's talk about how, if you're not familiar with how you get the shared data, how you do that. So you can see here, this is our website. This is g2aging.org. And for links to download any of the survey data, you can click on this download button here on the left. You can see these are all the surveys which are included. And share here is in our fourth column. And so links to download survey data. So we can go to MIA or Share Project, the Share Project website, and we can download this. And in particular, once you're logged in to their data research data center, you're going to want to download the data for wave 1, wave 2, wave 3, wave 4, wave 5. We include we use data from all 5 waves, although in general wave 3 was just a life history survey, so although we take some information on there, it's not the usual survey. We'll also use this longitudinal weights data set and an all waves cover screen release. So these 1, 2, 3, 4, 5, 6, 7, 8. These are the 8 files which you will need to be able to create the harmonized share. So once we have those, we can, from the gateway to global aging data, we'll download the harmonized shares data creation code. And you'll do this back on this same download data and links page on the gateway to global aging data. And here under share, we can say harmonized shares data code. And when you click on this, we can say download harmonized shares data code. It is going to require that you be logged in. So I'm going to log in. All right, and let's download this. And we will open this up just in Stata so we can see what this looks like. All right, so this is an extremely long file. So this is one file that has lots of different codes to create the harmonized share. And the harmonized share, just in case you're not familiar with harmonized data, it's a kind of simple, user-friendly version of share, which is designed to be comparable to the other HRS surveys. In this file, there are a few things that you will need to edit. As I said, we'll have to download these different files. So you're going to have to list on your computer where you put these files. So if I put this in, let's say I download all of the files exactly to the same place on my computer, which is C drive share. We're going to go through and we'll edit all of these to say C drive share. Do this a little quicker here. So I've got all my files here. This is waves 1 through 5, as well as over waves, which are those the cover screen data and those longitudinal weights data. And then we also have an output folder. So this is where you would like the data set to be saved, the harmonized data set, once you have run this code. You only have to run this code once, and once you run it, then you have it available to you. So once you did this, you could just run in Stata. You can run it by clicking execute.do here at the top. This running it will take probably on the short end about 3 hours because share covers so many countries and they now have 5 waves of data. It takes quite a bit of time to run. So I'm not actually going to run it here, but I've already run it. And once you run it once, you'll have the harmonized share and you won't have to run this again. All right. So now we've edited our folder locations. We've run the shares data code, creation code in Stata. And then the other thing we want to do is we want to make sure that we have documentation so that you know what is in the data set. And you do that using the harmonized share codebook. And that's available again on this data and download links page here for harmonized share. You can also download the harmonized share codebook just by clicking on this button here. And we can open this up so you can see what this looks like. So this is the harmonized share documentation. You can see that we have a whole host of variables which you can use the bookmarks through. So we've got demographic variables, healthcare, cognition, financial and wealth variables, income and consumption variables, family structure variables. Those are where we have those financial transfer variables. Employment history, retirement and expectation variables, and pension variables. And this is version C.3, which we just released last night or this morning. All right, so it looks like we have kind of the things that we need here. I'm also going to go ahead and open up Instadata, our shared data set, which we downloaded. All right, so the first thing, the second step here is we're going to identify our relevant variables. We're going to be using Share Wave 5, which was conducted in 2013. So that's kind of just the year we're looking at. In this case, we're not using Share as a longitudinal survey, but just we're going to look at this cross-sectionally. So we're just going to look at people who were interviewed in 2013. And there's some variables that we'll need. And there's our share data. So we're going to need a measure of any giving to children. In this case, it's a binary. We'll need a country identifier, so we'll know what respondents came from which countries, because we're going to look at this across different countries. We'll also need a couple identifier. The harmonized share and all harmonized data sets are built at the respondent level. So for each respondent, they're at one observation in the data set. Of course, when we're talking about giving to children, this is usually considered a concept that a couple does. So we want to be able to know who is one couple or an individual who is single. So we have a couple identifier to make sure we're not counting people twice. We can talk about that more. We'll also look at a respondent age and a spouse age. For all of the harmonized data sets, we have spouse versions of all variables, which are really helpful for instances like this when we're going to make kind of a household age where we want to take into account both the respondent age and the spouse age. And then we have a household analysis way. So if you wanted to know how would you kind of find these on your own, there's two ways that you could do that. And the first I'll show you is on the Gateway to Global Aging data. And you can do this using the concordance that we've built. So if you click on concordance across studies, we could click on harmonized share 2012, 2013, and we can look for things. We can say we want a family financial transfers variable. We want a country identifier. We want a respondent age variable. Let's see, age and interview variable. Let's just click those, and we can search for that. What we'll get here is exactly the variables that we're interested in. So you can see here we have those names. So we have R5AG and S5AG, the respondent and the spouse. Age, we have age in years and months. We're going to just use years here. And then we have these financial family transfer variables also. Let's look at the other way, which would be to look at the codebook. So you could go through the codebook. You could search through it. Or we could just use our bookmarks here, so we can look at country. You can see we have this variable called ISO country. That's the variable we're going to be using. You could also look for age at interview. The advantage of the codebooks is that there's a lot of information in these codebooks. So you can see a lot of information about exactly how it was constructed, which is important to know. And in all the codebooks, we also list all the variables that were used in the creation of that variable. So you can see these are all variables which are taken from the share tracker file, that all waves file. All right, so we've got our variables of interest. You know those. We're going to create a few additional variables. And one thing we want to create is a couple tag. And by tag, I mean we're going to highlight just one person in the couple who's going to represent the couple for the analysis. And the reason this is important is because we're looking at something that's couple level here. And we're going to be doing kind of a summation. We're going to be creating some summary statistics. We don't want to count both people who were in the couple twice whereas we're only counting once for someone who is single, right? And they're both financial units who would give to their children, their family units. So we want to make sure we're only counting them once. So we're going to create a couple tag. We'll do this by sayingegen. We're going to create this couple tag. I'm going to call this H5 couple tag. And it's quite simple. In Stata, we're going to say tag H5 cup ID. So let's actually jump over to Stata into our harmonized share, which is open. And we're going to open that it's a do here. We're going to open that do file, which I mentioned before, which I have on my desktop and webinar. So advanced share webinar part 1.do, open. All right, so the first thing we do is we just check the giving to children variable. We can see that it ranges from 0 to 1, so it's a binary. Since it's binary, we could also tab it, which might be slightly more interesting. So you can see that overall, it looks like 25% of, now this is everyone, this isn't couple level here, this is respondents, of 25%, a little over 25% of share respondents in wave 5 reported giving some money to their children. We can look at our age variable. So we have ages that range from 22 to 103 with the median age at 65. Of course, share includes both people who are age eligible, meaning 50 and over, and their spouses, even if not age eligible, right? So clearly there is someone who is age eligible here in the share who is married to someone, quite a few people who are a bit younger in their 20s. So those people are in the share data, as so much of our own decisions are our environment and who's around those. So it's important to account for. We're going to check our country variable. So we're going to tab ISO country if in wave 5. So these are wave 5 countries. You can see these are the countries which are included in wave 5. This is that ISO variable. If you're not familiar with ISO, it's a set of international numeric codes to represent countries, and it's generally how we use to define different countries. So the 3-digit numeric code for Sweden is 752. For the Netherlands, it's 528. We'll be using that as we kind of program our way through this. And then we're going to create our couple tag, which we just talked about. So you can see here, if you look at this, you can see that we have, using our cup ID, so our first couple ID is just an individual by itself, by him or herself. We could add our gender variable in here, and you can know whether it's him or her. So they get a 1. Second one is an individual by itself. So for the couple tag, they have a 1. Respondents 3 and 4 are a couple together. They're person number 1 and 2. So we assign a couple tag to just one of them, meaning that when we do our analysis, we're just going to be considering that first person, that first level of observations. But of course, we're looking at couple level observations. So in our next step, we're going to create a couple age indicator. So of course, as we mentioned, couples are not all the same age. You can have really vastly different ages. But we're going to create a household age or a couple age in this for this analysis. And I'm going to do this in this case by just taking the minimum age, which most often means you're going to be taking the female's age, but of course, you could take also the mean of the two ages together. You could look at the max. You could look at always the age of the man or the woman. There's different ways to create this, and it really depends on what you're looking at. But for the case of this example analysis, we're just going to be looking at the minimum age. And then we're also going to create some age categories because it's sometimes helpful to look at age categories. So in this case, our age categories are going to be 50, 60, 70, and 80 and over. So if we jump back into Stata, you can see that we create this, and then here are our age categories, and you can see that we have people, we've got in Share Wave 5, we've got 20,000 people, 50 to 59, 60 to 69, almost 22,000, 14,000 in 70 to 79, and almost 7,000 in 80 and older. We've got all our people there. You can also see that you notice that there's some couples or some respondents who we don't have this household age for. And of course, that's because the youngest person in that household was less than 50. So we are excluding them. We'll be excluding them from this analysis, which could be a good decision, could not. It's something to think through for any analysis. All right, in our next step, we're going to apply weights. And one of the reasons this data is really popular for analyzing this complex survey data like SHARE is they have this set of commands, particularly for estimates generated from survey data. So we're going to use the SDSet command, and we're going to say SDSet. This is our P weight, our probability weight is going to be R5WTHH. You could find that weight and lots of information about that weight using the Harmonized Share codebook. And we also want to set that our strata, meaning how the weights are done, is by ISO country. Because of course weighting is done per country, not for Share as a whole. So we want to set that. If we go back into this data, we can go through, we can apply those weights using our SDSet command. All right, so let's actually get to some analysis. So let's analyze giving to children across countries. So the first thing that we can do is we can estimate the frequency of giving to children in all Share Wave 5 countries, those countries that we looked at earlier. And the nice thing about this is that we don't have to tell Stata how our weights are set up or how the sampling was done. Again, we can just say SVY, comma, and what that does is it recalls everything that was told to Stata in SVYSet. And in this case, we're going to just be taking the mean of our binary, whether you're having given to your children in Wave 5 variable. And we're going to, remember, we only want to look at one observation per couple. So we're going to use our couple tag. And when you use SVY to use a couple tag, you want to make sure to put any conditions which limit your analysis in this subpop phrase. So we're going to say subpop if H5 couple tag, which in Stata terms means if H5 couple tag is equal to 1, if it's equal to 1. So let's go through and estimate that. So you can see that on average, it looks like we would estimate for the countries which are covered by Share, for the ages which are covered by Share, which of course are 50 and over, a little above 24% of couples report financially supporting their children. Of course, Share is made up of lots of different countries, and it might be more helpful to actually look at some particular countries. So let's look at Sweden and the Netherlands, two different countries. So we can estimate the frequency of giving to children in Sweden by using that exact same command, but we're also going to add a condition in our subpopulation parentheses there, which says and ISO country, so our ISO country variable is equal to 752, and again 752 is that ISO country code for Sweden, and then we'll do the same thing for the Netherlands. So first, if we look at Sweden, it looks like it's actually quite higher than all Share countries. So it's 36.5% of households in this age range, or couples in this age range, in Sweden are estimated to financially support their children. And then if we look at the Netherlands, it's actually a little bit lower. So it's just at 20%. Are there to support their children. We can also analyze giving to children across all of the countries and then test whether those are actually statistically significantly different, those different estimates. And we can do this, again, our code is going to look very similar. So SVOSet, we're going to set our subpopulation, making sure we only have H5 couple tags, so one couple per observation. We can take our mean of our variable, but in this case we're going to use an option called over, and we're going to say over ISO country, which means for all the values of ISO country, that we have a value of H5 TCANY for, we're going to estimate those differently. I just noticed that we have a question from Don Hee Kim. So the question is there missing data, and how do you usually deal with missing data in SHARE? So we definitely have missing data here. There are people who, when you ask this question, do you financially support your children? And they say, I don't know. Or maybe they're tired of the interview and they've entered the interview soon. We could, of course, look at how many couples that is affecting. SHARE does a really good job with a lot of the financial variables of providing imputed data. So that's one way to deal with missings, which SHARE has done a lot of this for you, is that they will give you a kind of an assigned value in a way that we believe doesn't probably bias your estimates, but it really depends on what you're looking at. For this kind of simple example, we're just going to ignore the missingness. But I think for any question that you ask, especially with survey data, is you want to always be aware of what the missingness is, and what are the assumptions we believe in that missingness, whether we believe it's actually a random missingness, or do we believe, perhaps that maybe in this case, that people who are much older are more likely to not know if they're financially supporting their children, or if maybe in certain countries there's some kind of cultural bias where people might not want to report about financially supporting their children, or to over-report, of course, about financially supporting their children, which could lead to them not reporting, which would be kind of a biased missing. So you do need to account for that. I think how you deal with it depends on how much missing there is and what is the question that you're asking. So I hope that answered that question. And so once we have our two estimates here, we can jump into Stata. So we're going to generate estimates across all of these ShareWave 5 countries. You can see these here. They list the countries, and then they also list, so this is for each subpopulation, and these subpopulations are each country. So for Sweden, which we saw before, which is subpopulation 14, again, we get that 36.5 mean of our binaries, so we can communicate that as a percentage. So 35.6% of people in this age range in Sweden are predicted to financially support their children. You also notice that Sweden is at the very high end here. At the very low end, it looks like it is Spain, where less than 10% of people report financial or estimated to financially support their children. So there's a lot of variation here in different country arrangements. And one of the things we might want to do is test whether those are statistically significantly different. So we can test the difference between, say in our case, we're going to look at the Netherlands and Sweden again, and we saw those kind of different numbers, right? 20% and I think 36%. So let's see if those are statistically significantly different, and we can do that using this test command, which is a post-estimate command that will run off of this mean estimation. So we'll test the variable that we're testing here, subpopulation 1 estimate, or subpopulation 11 estimate versus subpopulation 14 estimate. And when we can do that, Stata conducts an adjusted walled test, and you can see that it is the probability that it's greater than f is 0.00, so we would certainly assume that that is the statistically significantly different estimate. If we wanted to look at this across all countries visually, which is somewhat more interesting sometimes, so we can see all countries. So we can see here that Sweden was really at the high end here. Close to 40% of these households in Sweden are financially supporting their children. And again, Spain is at the very low end, less than 10% of countries. And of course, there's a lot of countries kind of in the middle: Belgium, Estonia, maybe France, Italy, Netherlands is about in the middle, Switzerland is in the middle. But so a lot of variation, even between countries that ones might seem more similar, like Sweden and Switzerland. Maybe you assume that they're very similar, and there's actually seems some real differences in whether people are financially supporting their children. So we also talked about, we want to look at it by country, but we also want to look at it across different couple ages. We made that couple age variable, if you recall. So to do that, we're going to estimate mean difference for each country age group. So we're going to do this by saying SVSet. We're going to get a bunch of estimations here, and the only thing that we're going to change here is over. Instead, we're going to put over ISO country and our age 5 age category, our household age category variable. And you can see that we get all these subpopulations, so 1 through 60. Of course, these are going to be a little bit smaller. For each country, we now have 4 estimates for, again, people 50, 60s, 70s, and 80 and over for these different ages. So one thing we might want to test is for these two countries which we're looking at, is are there differences between, say, the youngest, the people in their 50s and people in their 80s, to get a sense of whether there's a difference. So we could test the difference perhaps for Sweden between the estimate for subpopulation 53 and 56. If we look at that here, we can see that for people in their 50s in Sweden, or couples in their 50s in Sweden, about 47% of them are estimated to report financially supporting their children, and in their 80s, only about 24% of them are estimated. So actually it looks like quite a big difference there. And we can test that difference also. Just as we tested before, the only thing we're going to test differently here is we're going to test, we're going to change our subpopulation groups, again 53 to 56. And let's also look at the difference for the Netherlands. So we scroll back up, so Netherlands 50 is subpopulation 41. And Netherlands 80 and over is subpopulation 44. All right, so here are these. It looks like much more kind of level here, so I wonder if there is going to be much of a difference. And when we test this, we're going to see, it looks like there's not a statistically significant difference between these oldest and the youngest couple groups in the Netherlands. We could also look at this graphically, which of course sometimes makes things easier. So you can see things are very level for the Netherlands. It really looks like maybe there's no statistically significant difference at any age group. There's a really pronounced difference in how people at different ages are supporting their children in Sweden. So one thing to note is that because this is cross-sectional data, 2 things could be happening perhaps in Sweden. And one is a cohort effect. So one is that people born at different times, perhaps here we're just seeing that older people, older in the sense that they were born earlier, that their generation is less likely to support children, or we could be seeing that there's actually an age effect here, which is also possible, right? Which is people at older ages, regardless of when they were born, are less likely to support their children. One of the nice things about having longitudinal data is you could go back to the other waves of share, and you could look at how people performed, say, in wave 1 of share in Sweden. So you can look at how these people who are now in their 80s were also supporting their children in their 70s to get a sense of that, pull out that difference between a cohort effect or an age effect. All right, so let's get kind of to part 2 of our analysis, which we want to bring in. We're going to do a cross-study analysis, and we're going to bring in the harmonized Charles data. So how does financial support to children in European countries compare to financial support to children in China? And we can look at this, again, both by level for the whole country and by these different household ages. It's going to be a slightly different approach than the one that we have now, though, so let's talk about that. So our first step would be to download the harmonized Charles. We're then going to identify the relevant variables in the harmonized Charles. We know what those variables are already for share, so we'll identify those for Charles. we'll create a pooled data set. It's also sometimes called a stacked data set, and that has variables and observations from both harmonized data sets. We're going to prepare our variables, we'll apply our weights, and then we'll analyze giving to children across countries. So we'll have our share countries plus China, and then we'll analyze giving to children across ages and countries. So to download the Harmonized Charles, you could go back to the Gateway to Global Aging Data, and you could use this link here for Charles, which would take you to the National School of Development at Peking University, and you can download the Harmonized Charles here. The nice thing is with Charles is they actually provide the harmonized data set, so you don't have to run any Stata program to download it. You can just download it as a Stata file, the harmonized data file, by clicking this link once you have registered with Charles. So that takes a little bit of the legwork out, which is quite nice. So once we have that on our computer, we're going to identify the relevant variables in the harmonized Charles. So just like the harmonized share, the harmonized Charles is accompanied by a codebook. So here is the Harmonized Charles codebook, which you can download from the Gateway to Global Aging Data. And again, you're going to see very similar sections because the idea here is that they're harmonized, that we've made these different variables very comparable between different countries. So you can see we've got demographics, health, healthcare utilization, cognition, almost all those same sections that we have for the harmonized share. So we could find those variables of interest. So in particular, we need, again, a measure of giving to any children. We're going to keep the same year for our analysis for the harmonized, for the China estimate. So it's 2013, which was wave 2 of China. So our measure of any giving to children is going to be H2, and then again, that same variable string, which is HTCANY. Because they're both similarly named, you'll also both know that they're coded the same way, so these are both binary variables. We need a couple identifier. Again, we need to respond in age and spouse age, and a household analysis weight. Let's see, we just have a question from Hugh Chin, who says, do the weight variables bring the samples into balance with age distribution of each country? So this depends on the study itself. I know that with share it does. Inside of the harmonized codebook, if we go to let's go to Charles, let's go to share here again, we can look at the weight variables. So we have household weights and person level weights, and you can find out more information exactly about how this was constructed. I think at the base level, all of the weights usually take into account gender and age distribution of the country. They often also account for other kind of aspects to kind of get the best actually population estimate. So yes, almost always they would take into account the age distribution, but you should check exactly how each weight was constructed. So here we see shares calibration is based on the size of each country's population of individuals born in 1962 or earlier across 8 gender age groups. So certainly yes, for sure. All right, so if we've found these variables, and again we could do that using the concordance tool on the Gateway to Global Aging Data or using the Harmonized Charles codebook. We're going to then create a pooled data set with variables from both harmonized data sets. And if you're following along with data on your own, this would be that second handout, that part 2. So I'm going to open that up myself here. Clear out this. And as a share webinar part 2, I have one for myself here that already has the file locations. If you're doing this on your own, the only thing that you need to change is to list the location of these 2 harmonized data sets on your own computer. and then you can run this and follow along. We're just going to start running this now. Oh, I need to make one change. All right. Okay. So the first thing we want to do, jump back here to our slide, is we're going to bring in the share data. Again, we know which variables we're using from the harmonized share. So we're going to use our Wave 5 financial transfers variable, our country indicator, couple ID indicator, spouse and respondent age of Wave 5, and we need our weight for Wave 5. We're then going to append using H. Charles. That's the name of the harmonized Charles data set. In this case, we're going to say keep, and we're going to keep our Wave 2 financial transfers to children, our Wave 2 couple ID, respondent and spouse age in Wave 2, and our Wave 2 household weight. We're also going to generate an append variable, and an append just tells you whether or not this is from the what they call the master data or the appending data. We can then assign to that data which was appended, we can assign a value of 156 to ISO country. That's the country code for China. And then we can also, just so we make sure that we're clear, we can make this variable, which we'll call study, which tells you whether the observation is from share or from Charles, just to make sure that we're keeping things separate. So if we do this inside of Stata, so then we can read in our harmonized Charles variables. Let's see, and we define our study variable. If we tab our study variable, you can see that we've got 21,000 observations from Charles and 107,000 from share. Of course, these are people from all waves. These are longitudinal files, so they have people. This is for share. This is everyone who participated in share waves 1 through 5, and for Charles waves 1 through 2. So it's going to be slightly smaller. Smaller numbers for in this wave that we're considering now, which is the 2013 wave. So first thing we're going to do is we're going to adjust for differing wave numbers. You notice that we use, for our variable names, the wave number is part of the variable name, and that's how we make this FAT file, this longitudinal data set. But we're going to change these so that we can be consistent, because of course 2013 is wave 5 of share, but it's wave 2 of Charles. So we're going to create first a financial transfers, whether any financial transfers to children in 2013 variable, and we're going to use our study variable. So we're going to say if it's from share, we take the value from the H5 TCANY and wave 2 of Charles. If you have any questions about what are the waves and how they compare to each other, on the Gateway to Global Aging Data, if you click on Surveys at a Glance, the first page you get here is this study overview of core interviews here. And so you can kind of see here a nice layout of when different studies conducted their waves and what the wave numbers are. So for studies which were conducted in 2012 to 2013, that's wave 11 of the HRS here in the US. Again, it's wave 5 in share, and it's wave 2 of Charles. So if you want to create a cross-country analysis or a cross-study analysis looking at the same years, which might be important, especially if you're thinking about something that might have happened globally, this chart is a good place to start. All right, so if we jump back into Stata here, we can create these variables. We'll also create our kind of year-named respondent age and spouse age variables. We need to create a couple tag, just as we did before. So the first thing we're going to do is create a couple ID, which is consistent across 2013. One thing you might want to note is that so couple 1 in share is not the same as couple 1 in Charles. They're both going to have a couple 1. So when we create our tag variable, we want to make sure that we tag both our couple ID tag and the study tag. And what that does is it looks for if you're couple 1 in share that is different, it knows that you're different than couple 1 in Charles, and it tags you appropriately. And then we're going to create our couple age categories just as we did before, and just for this example analysis, we're going to be using the minimum age of both the respondent and the spouse, assuming there is a spouse. Of course, if there's not a spouse, it's just the respondent's age. And then we're going to create our age categories, which would be the same here. Rita just asked, she said, I just missed part of your presentation. Thanks for joining here. So we will have this question of how can I download the harmonized data for share in SPSS. So you cannot download, just because you missed the first part of the presentation, you cannot download the harmonized share in any format. You have to create it. And we create it using a distributed Stata code. So you have to actually first run the harmonized share Stata creation code in Stata. Once you've done that, I would then suggest using a program like Stat Transfer or some other kind of program to change that data from Stata to SPSS format. We do have some information about how to do that. Again, if you go to data, download, and links, and if you click on the harmonized share Stata code, we have some information here about how you might transfer it to a different package other than Stata. I will say it is only the harmonized share and the harmonized CLOSA, the Korean data, which you have to run this data creation code for. All the rest of the studies distribute the harmonized derived files themselves, and they usually distribute it in Stata, SPSS, and SAS format. So for any format you're looking for instance, for ELSA, you can download the harmonized ELSA, that's English data. You can download that data in any of those formats directly from the ELSA team. I hope that answered your question. All right, so let's jump back into Stata. So we're going to create our couple tag. We'll create our age categories. So that looks great. We could tab our age categories here by ISO country, just to see what kind of age categories we're getting. Yeah, so we can see here, these look like pretty good numbers. We might want to note that, say, give a heads up to any really small numbers. So like Luxembourg, we've got pretty small numbers, especially like 80 and over. It's just 100 people. So of course our estimates, the standard errors in those estimates are going to be quite large. It might be hard to say something statistically significant about those. Also for Switzerland, it looks like kind of low for our 80 category. So those standard errors or those confidence intervals might get kind of large there. All right, so we're going to apply weights. Our applying the weights is going to look exactly the same. We made this weight variable, which is the weights from both studies, which is okay because we're going to set our strata as country, so we know that the weighting was derived differently for each strata, in this case country. We're going to estimate our frequency of giving to children by countries in both studies first. If we tab through here, we're going to apply our weights. You can see these are the weights for all the countries. The stratum here are the country codes. And then we're going to use SVY subpop. Again, we're going to say if you're the observation that we're looking at for this couple. The other thing that we do here is we set an age range, and that's because the ages at which share was conducted are not the same as the ages which were conducted in Charles. If you're interested in looking more about this, from this Surveys at a Glance tab on the Gateway to Global Aging Data, you could also click on Study Overview, and one of the things it would tell you is age eligibility. So Charles in China starts looking at people who are 45 and older, whereas Share looks at people who are 50 and over. So one of the things we want to look for in our analysis is just make sure that we're comparing people of the same ages at this point. And we're going to do this over ISO country. So you can see here we get all our estimates just like we did before. And let's see, China is going to be our subpopulation 3 estimate. So if we look at China, it looks like it's quite high here. So it's 37% of people with a household age of 50 or over, in this case, are estimated to financially support their children. If we look at this graphically, so it's the exact same graph, but we have China added on, and what we see is that China looks like it's really on par with Sweden as being quite high. I think China might be just a tiny bit bigger if I'm remembering the numbers. Let's see, China was at 37, yes, and Sweden was at 36.5, so slightly bigger. And we could test whether that is statistically significantly different, of course, using that test command. But for now, we're going to just look across different ages. So one of the things that we saw is that in certain countries, like Sweden, there seemed to be a real change in people at different ages for the amount that they financially supported their children, ages in 2013. We saw that in the Netherlands, age really had no effect in 2013 of who was financially supporting their children. So let's look at China and how they relate similarly or dissimilarly to those two. So we're going to get all these subpopulations. Let's see. China is going to be subpopulation 9 for 50s, households in their 50s or couples in their 50s, and 12 for 80 and over couples. Let's scroll down here. So we can see it looks like there might be a little bit of a gradient there. And again, we could just test that difference as we did before. We can see that for households in their 50s, we would estimate that 38% of them financially support their children. And the 80 and over, it's 24%, which looks like it might be a difference. If we want to test that difference, again, we'll use it using adjusted wall test, subpopulation 9 versus 12. And we can see the difference there, a statistically significant difference. And if we want to look at that visually, we can see that although the gradient for China, there is definitely looks like there's a gradient. The gradient doesn't look as severe as we saw in Sweden for different age groups. Which is interesting, but there is still a gradient unlike the Netherlands. So we have kind of a few different models here for how things might be different at different ages in different countries. And this kind of approach is generally considered a difference in difference approach. So although we looked at graphs and we did estimates for countries as a whole, often it's more interesting to look at how countries inside of themselves are different from how other countries are inside of themselves. So for instance, we're looking here at the difference in country of different patterns in ages. This is a difference in difference approaches, and this is often how cross-study or cross-country analysis are conducted. Yeah, so that wraps up our advanced webinar for today. Again, the slides and everything will be available online. Let's see. I just have a question. How was the weight variable created for comparing Cher and Charles? So what we did there is we just took both weight variables. Let's see if I can go back here. So if you see on this page, we just took both weight variables and we assigned them from each study. So this is the weight variable that was provided by Cher and the weight variable that was provided by Charles. Of course, those two could be created differently, and you should be aware of how they are created differently. But we are telling Stata can technically do this because of how we're setting our SVY set, which is that we're saying in different countries the weights, these weights are estimates for inside of that strata, or in this case, inside of that country. So thank you for joining me today. I appreciate it, and great questions. If you have more questions, we have a help desk here at the Gateway to Global Aging Data, and you can email us at any time. Our email is help@g2aging.org. We also have on our help page some kind of common questions that you might have, you might need answers to. For instance here, do you provide harmonized data in formats other than Stata, which gives you a little more information about those. Also, let's see, the video of today's webinar, the Stata codes used, and the slides will be available on the documentation and presentation website. And those will be down here in recent presentations. We also, if you've enjoyed this, we appreciate if you would tell your colleagues. We have a few more upcoming webinars coming up in May. Again, we'll have an introductory webinar, so someone who's not familiar with it might find that interesting, and that's May 4th. And then we have another advanced webinar, and this one's using Harmonized ELSA, so that English data, and that's May 16th. So we also have those coming up. We also have a Facebook group, which we'd love for you to join us on. And we have a Twitter account. So I will hang out and answer any questions that anyone might have for the rest of this. But thank you so much for joining us today.